Paola researched rhinoplasty carefully, surgeons, results, even other patients. So, why did the final decision happen so fast?
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
And I do feel like maybe I should have given myself more time between meeting the doctor and the surgery because it all happened within a week.
Where did you then research to find the surgeon that was right for you? What was your process to research?
I looked up a lot of profiles on Instagram and Facebook. I researched a lot of surgeons. So I picked the ones that were within my budget and went with the doctor whose work matched what I wanted most, because every doctor has their own way of working. So I saw that doctor and thought, he does noses like the one I'd like to have. Or I looked for cases with noses similar to mine. And his results, so I checked out his work, looked at the noses he'd done, contacted girls who had surgery with him, and I went to a consultation. He did a simulation for me, and I said, he's the one. I didn't consult with anyone else after that. He fit perfectly within my budget, and I really liked his work. Plus, he was both a cosmetic surgeon and an ENT specialist, which was exactly what I was looking for. Not just something aesthetic, but also a functional nose. A week later, I put down the deposit, and the following week, I had the surgery.
Okay, so if you were getting another rhinoplasty, which we hope you never have to do, the things that you would suggest a patient like you researching is the vibe of the doctor, proof befores and afters. And I think it's great that you were able to contact some of his patients to actually talk to them and get an understanding of his technique and bedside manner. Sounds like you really did your due diligence. As you were researching the right surgeon to be your rhinoplasty surgeon, what risks did you become aware of?
Well, I think the biggest fear for those of us going through this surgery is the outcome, not liking the result or it not being what we expected. But once you sign the consent form and you're about to have the surgery, and they tell you about all the possible risks, you end up with 1,000 more fears. There could be brain issues, the anesthesia. After all, it's still a surgery at the end of the day. So, yes, I had a lot of fears on the day of the surgery. But if you ask me before the outcome, I think that's the biggest fear we all have, that we won't like the result.
And that's a risk. Yes, you're investing a lot of money, time, emotional effort, therapy into getting the result that you want. And it's possible that you might not get the rhinoplasty result that you want. Knowing these risks, and especially the one about, you may not get the result you want, what made you feel safe enough to actually move forward?
Trusting the doctor and trusting the process, because not everything depends on the surgeon's hands. It also depends on our bodies, on how we heal. I can't ask for a result like a nose I saw on the internet when that person's face isn't the same as mine. Maybe their face is slimmer, more delicate, so they have the chance to have a finer nose, or their skin is thinner. Mine was thicker. So it's something you need to research, and you have to prepare yourself mentally that you won't see the final result until after a year. In fact, as of now, my rhinoplasty was 4 years ago, and even now, there are still changes in my nose. Some days it's a little more swollen, some days it's really slim. So you have to prepare yourself mentally that there are a lot of factors and you need to be ready for anything, for whatever comes. And you have to realize that not everything depends on the surgeon, but also on you knowing what kind of nose you have and what kind of nose you can realistically have after surgery.
Right. Okay. So I did not know that even 4 years later, I guess the nose can change and morph and just like a nose that hasn't been operated on, and that's just something we need to be aware of, whether you had rhinoplasty or not. So you had thicker nose skin. What did your surgeon tell you about having thicker nose skin? How would that affect his procedure, his technique? Did he give you a little bit of insight into how it may or may not, look differently than what you would imagine?
Yeah, actually, I thought my skin was thin, so I went in thinking this is going to be an easy job. He can give me the nose I want because my skin is thin, and it doesn't look like it'll be a lot of work. But when I went in for the surgery, he told me, "You have thick skin, and it's a little harder to work with that kind of skin." So, yeah, that's how it was. It was a shock because I went in with a different idea and wanted a different kind of nose. But well, at the end of the day, it's like we said before, I was basing everything on the internet. And then during the consultation, he did a 3D simulation for me. He edited my nose so I could see how it might look. And honestly, there was not much difference between that simulation and how it actually turned out. That's when I thought, well, it's not exactly what I wanted, but I like it. I'll take it. I'll accept it. And so, yeah, you kind of walk out thinking, well, it is what it is. But you trust the process and you trust the surgeon. And something my partner told me at the time was, look, it's going to look better than how you have it right now. So I think that's what I kept telling myself.
I love that, and I cannot imagine being able to actually see a 3D evaluation of your nose. I think that would give me a lot of trust. Like, this surgeon is really digging deep and taking a look at even, the skin thickness or thinness and taking the time to put together the right game plan. That feels so wonderful.
And it's nice because when you see it, I think what happened to me was that I started dreaming about that nose. I mean, when I saw the edit he did and how my nose could look, I was already dreaming about it. I could already see myself with it, and I just wanted to have it?
She trusted the surgeon and moved forward. But surgery was only the beginning of the story.